So total knee replacement involves resecting a couple millimeters of bone from the ends of the femur and the ends of the tibia in order to recreate the joint surface. Almost a better phrase for it would be joint resurfacing, because we're not hacking off the ends of bones and putting in and dropping in an entirely new knee. What we're really doing is recapping the ends of the bone, similar to capping a tooth. So there's a brand new cap on the femur, there's a brand new cap on the tibia, and then there's a plastic spacer that gets put in between that substitutes for the cartilage. And that's what a total knee replacement is. Now for patients who have total knee arthritis, or arthritis in all three compartments of the knee, that's a perfect solution for that problem. However, there are some patients who have limited arthritis and only have arthritis in one compartment of the knee. And those patients don't necessarily need to have the entire knee resurfaced. They really just need that one part of the knee resurfaced, and we call that a partial knee replacement. So the ideal candidate for a partial knee replacement is someone who has only arthritis limited to that one compartment of the knee, and the rest of the knee, the cartilage is still intact.